This was from that was a slide presentation about regulatory capture and saying why only non-healthcare business can save America from the healthcare industry. Now just sit back and think about that. Why only non-healthcare business can save America from the healthcare industry, to save you from the healthcare industry. And it's because these are the winners, nearly everyone in the healthcare industry, except primary care and except nurses. That's who wins. It's the administrators, it's the people at the top. They have so much power. When I saw what those hospitals were doing with Trump, they're all their doctors downtown at Northwestern putting all their hateful papers out in 20. I thought, what is wrong with you? Like, just talk about bias. But they didn't care. They have more power. It's really quite disturbing. The losers, patients, right? Unnecessary care and risk of harm. I'll get into the unnecessary care in a minute. Purchasers, employers, taxpayer, individuals, immense unnecessary costs, primary care physicians. Those are the losers. And this is regarding lobbying and healthcare policy. A person can reach no other conclusion than this is a quid pro quo, this for that activity. That's what it is. It's pay for play. It's what it is. It's not about healthcare. It's not about health anymore. It's not about care anymore. It's about lobbyists. It's about all the healthcare professional associations and organizations all being in bed with the politicians, and all of their people are chief nursing officers in hospitals and freestanding psych hospitals across this country, and they're the lobbyists. Their people are the lobbyists in the politicians' ears. And then they cut it, they chopped it, they reconstructed it, they didn't bury it. I don't think they wanted to. Princeton professor of public affairs. That's regarding lobbying and healthcare policy. Lobbying and healthcare policy in 2009, healthcare organizations spent $1.3 billion to lobby Congress. Unbelievable. 3,330 lobbyists participated. 6 for every member of Congress. So 6 healthcare lobbyists for every member of Congress. So do you think that those Congress people that you elected are even thinking about listening to you? No. No, because it's all it's all a game. 6, think about that. 6 for one member of Congress, every member. In other words, policy is developed to favor the special rather than the public interest. Oh, so perfectly put. Unnecessary and inappropriate care and cost. Our research found that wasteful spending in the healthcare system has been calculated at up to 1.2 trillion of the 2.2 trillion spent in the United States. 54. Almost 55%. Redundant, inappropriate, or unnecessary tests and procedures were identified as the biggest area of excess, followed by inefficient healthcare administration and the cost of care necessitated by conditions such as obesity, which can be considered preventable by lifestyle change. And the conclusion of the slides I just showed you, and I think I had one in my last video, healthcare's excesses threaten the stability of our industry and the larger U.S. economy. Yes, it does. And it doesn't just threaten the economy. It threatens care and health and everything. Something has to be done. Like, I get that, people want to say, well, I believe in this. Some people want to say, well, they believe in this ideology. Okay, but at some point when you keep going along with that ideology, okay, and you see that everything is getting worse and you don't have enough insight or intelligence to look in the mirror or look at your professional organization and say, maybe we're the problem, then to me it's like, then either you're stupid or you're really you just don't care about who you have to hurt to get to your goal of Marxism, to get to your goal of overthrowing America. So I know that people, want to say, well, there's a lot of people that just believe in this ideology, and we can't put everybody. I get that. But no, not at these levels. I understand students in schools get pulled into this, and then they get all cocky and think they know everything, okay, and they don't even know a thing. But this. Things have not gotten better in healthcare. Things have not gotten better in science. But you have all these genome labs up everywhere, okay? They're doing nothing but building more hospitals, more of these freestanding psych hospitals that are just dangerous, okay? Dangerous for patients, dangerous for staff. I mean, hell, they're admitting people just for depression now or anger management issues. What the hell is that about? We used to, as a psych nurse, you have to adhere to a criteria. If somebody was suicidal a month ago and you're admitting them, but they're not suicidal now, then they don't meet criteria. But it's all about money. That's why they're getting these nurses to be like an intake specialist or intake, so they're nurses, but they have these legal backgrounds. Yeah, those people need to be held accountable too. Just because you're going to find some way to loop it around so that you can admit as many people as possible doesn't mean you shouldn't be held accountable for that if you're a nurse. I don't care if you're a lawyer or not. You should know better and you should do the right thing. And I just wanted to show this. Goals of shared governance. Shared governance provides a framework for encouraging professional accountability. If it did, there's a ton of chief nursing officers in this country that should be held accountable, okay? There's maybe not probably a ton, because they go along with the stuff they know they shouldn't go along with. And then they think, because I'm in a leadership position, it's okay. No, it's not. So this model doesn't work. There was a time people were held accountable. But because of shared governance in nursing, because of American Nurses Association, because of the credentialing boards, because of your nursing boards in every state, because they all go along with the things that are harming healthcare, and they don't know how to do the right thing. This is why it's worse now. But if you see, it says implement practice, innovations including clinical practice guidelines and quick wins supported by peer-reviewed literature and other evidence. Increase nurse autonomy by giving nursing team members a voice in their daily practices. Yeah, that sounds all good, but then at what point is this when you don't have a team? Again, I was on a unit, I was by myself for half of the shift with patients that earlier in the day were beating each other up. Beating each other up too, had to be medicated. And then on the evening, you leave me on there all by myself. Because, well, there's nothing we could do. But then the director's talking about how we can admit, like, that's unsafe. They should be shut down, and it's no good to go to OSHA. I went that route. What a waste of time. Again, it's all regulatory capture. But it's interesting that this is the ANSOC, because I'm like, what is ANSOC? ANSOC stands for Army Network and Systems Operations Center. Yeah, it seems like all the models, besides them being Marxist models and Marxist agendas, are also tied to the defense departments, the military industrial complex. So this little model here, this looks pretty, but it's pointless. It's pointless. Because everybody controlling healthcare now at the top, it's all a corrupted, crony, capitalist, regulatory captured system, unfortunately. Because I'm a nurse. I've worked in it long enough. I've been in healthcare most of my adult life, even before I was a nurse. So it didn't used to be like this. But all the people running healthcare, same model, looks a lot like the one I just showed you on shared governance and nursing. Well, DEI, it's all the same sick system.